Hi there and welcome back to another edition of Chat with Troiano. Now that my district-wide tour is over and we've turned in the signatures to get my name on the ballot, I'm excited to continue our weekly conversations about ideas that can gain bipartisan support to tackle our nation's toughest challenges. There is no more important or tougher challenge facing our country than fixing our broken healthcare system, which threatens the competitiveness of our economy, the solvency of our budget, and our individual quality of life. That's why healthcare is the focus of my first detailed policy paper that my campaign released this week. And in it, reforming Medicare is a top priority, not only because doing so would help address some of our long-term fiscal challenges, but also because it can help push through delivery system reforms throughout our entire healthcare system. Medicare is a vitally important program that provides public health insurance to the elderly and disabled. It serves more than 50 million Americans and accounts for over 20% of total national healthcare spending. But as our country gets older and 30 more million seniors retire over the next 2 decades and need more care, and as this care gets more expensive, Medicare in its current form simply won't be able to sustain itself. Over the next decade, Medicare costs are expected to soar by over 60%. We're going to be spending $300 billion more a year in 2024 than we are today. That means Medicare is going to begin to crowd out other kinds of government spending, such as investments in our future. And it's going to require us borrowing more money in the form of higher debt. By 2026, Medicare's Hospital Insurance Trust Fund is projected to run empty. That means Medicare is not only not going to be able to keep its promises to today's seniors, but won't be able to serve tomorrow's seniors either. Inaction, as proposed by some candidates who either ignore the problem or pretend it doesn't exist, is the worst option on the table. On the other hand, irresponsible action, as proposed by Congressman Tom Marino, who repeatedly voted to turn Medicare into a voucher that would shift costs to seniors, well, that's the second worst option. The best course forward is to protect traditional Medicare and to further reform its payment system to reward providers for value over volume and to leverage Medicare's size and market power to push through these reforms to the rest of our healthcare system, so we can continue to cut costs while improving health outcomes. One idea is to offer a new option within traditional Medicare called Medicare Networks. This proposal, as offered by the Bipartisan Policy Center, would allow providers who join together to offer a full spectrum of patient services to share in the savings from higher quality, more coordinated, and more effective care. Medicare Networks, for example, might include small physician practices, large specialty providers, post-acute care facilities, and hospitals. These networks would encourage collaboration to improve patient-centered care while being collectively responsible for cost and quality. To encourage participation, Medicare would offer a premium discount to those who seek their care from a Medicare network and would gradually reduce physician reimbursements for those in the existing fee-for-service program. The new and improved models of healthcare delivery innovated through Medicare Networks could surely be scaled to serve the rest of the healthcare market. And while government can't solve all the healthcare problem, it sure can help lead the way. So what do you think? Please leave your comments and questions in the section below, and I hope to see you here next week.